Bismillahirrahmanirrahim. Assalamu alaikum. My name is Dr. Uzair Ahmed. Today's topic is for final year BDS. Now we are done with different types of jaw relations. The next topic would be selection of articulators for arrangement of teeth. So we will be discussing about there will be brief descriptions of what are dental articulators and what are their different types. Dental articulator is basically a mechanical instrument that represents the temporomandibular joints and jaw members to which maxillary and mandibular castes may be attached to simulate some or all mandibular movements. Basically, mandibular movements, as we know, that they are very complex in nature. Maxillomandibular relationships are also uh, very complex in nature. So, according to the you can say the quantity of movements that are replicated by articulators, they are basically classified into different types. Exact replication of mandibular movements of a human being are still not possible, but most complex articulators somehow replicate most of the maxillomandibular relations and movements. The purpose of an articulator is to hold maxillary and mandibular castes in fixed relationship and to simulate the jaw movements and to produce border movements, um, also to diagnose the state of occlusion in both the natural and artificial dentitions, and to plan dental procedures based on the relationship between opposing natural and artificial teeth. Also, they are helpful to aid in the fabrication of temporary restorations and prosthodontic replacements. Um, Moving on, they are also used to correct and modify completed restorations and to arrange artificial teeth, and also even in some cases, in complex cases, the diagnostic casts themselves are articulated, and then patient is educated with the help of articulators to understand and to replicate the treatments and show it to the patient. Better visualization of the casts and restorations in occlusion, especially from lingual side. This is the an articulator, and edentulous arch has been articulated. This is basically what we call is a lingual look test, in which the lingual side of occlusion is also seen through the articulator. This is a partially dentate arch that has been articulated. This is a complete denture tooth setup that has been set up, and there is a lingual look test. Lingual from the lingual side, teeth relations are also visible. These all types of you can say freedom is only possible of on an articulator and not on the patient's mouth. So articulators are very helpful in this way. So, in articulators, occlusion can be viewed from facial and lingual sides. One of the very advantages. Patient appointment time is reduced because all of the maximum time has been done over the articulator, and small adjustments are taken in patient's mouth. Patient cooperation and tongue and cheek hindrances are not eliminated, and more procedures can be completed in the lab. So there are different classifications for articulators available, but we the most convenient one is to classify them according to the movement, the type of movements they replicate of the patient. So, in according to the classification that is based upon instrument function, is the most accurate and widely accepted classification. Class 1 is the simple holding instrument capable of accepting a single record only, that is um, capable of replicating very few patient movements. This is class 1, which is also called hinge articulator or plain line articulator. Class 2 permits horizontal as well as vertical motion but does not record the orientation relation. We know that orientation relation is the Facebook, which is used record with the help of Facebook. So class 2 does not accept a Facebook record. There are further classifications of class 2, which are the type class 2 division A, which permits eccentric movements based on average on arbitrary values. These are some of the different of the names of the class 2 type A, and these are the representative pictures. And class 2 type B permits eccentric movement based on arbitrary theories of motion, like this. Class 2C is also permits eccentric movements based upon the engraved records obtained from the patient. These are the representative types of all the types of the articulators. Class 3 instrument accepts horizontal and vertical relation and also accepts the phase bow transfer. And class 3 type A accept phase bow transfer and protrusive interocclusal record. For example, Hanau and dentatus articulators. And class 3 B, basically it accepts protrusive interocclusal records. These are the representative pictures of articulators. Class 4 instruments accept three-dimensional dynamic registration and also uses phase bow transfer. And the condylar pathways are performed by the registrations engraved by the patient. TMJ TMJ articulator, class 4 type B, the condylar paths can be angled and customized. I will show you what do we mean by condylar paths. Semi non-adjustable, we also classify them according to non-adjustable, semi-adjustable and fully adjustable articulators. For the semi-adjustable articulators, the basic minimum requirement is done on semi-adjustables and has adjustable condylar and incisal guides, and they are also accept phase bow transfers. Basic parts that are common to all articulators include upper arm that represents the maxilla, the lower arm that represents the mandible, and the cast are attached on both arms, and also mounting plates that connects the cast to the articulator. Cast can be attached by plaster, screws, or magnets. These are some of the types of connecting plates. They can be either attached with the help of plaster or with the help of a magnet as well. Condylar analogs or condylar guidance is basically replication of the patient's TMJ apparatus. They represent the articular eminence in skull, which guides the movement of condyle. The articular eminence is present in the skull of the patient, and condyle is attached to the mandible of the patient. The condylar element moves along the inclines of the condylar guidance and together determines the protrusive and lateral movements of the articulator. Protrusive record is used to adjust the inclination of condylar guidance, or both horizontal and lateral. This is the condylar guidance. The sphere represents the condyle, and this housing of the sphere represents the articular eminence. condylar guidance. Incisal guidance represents the vertical dimension of occlusion, and it rests on the incisal table and can be moved along its surface. It also can be raised and lowered or increased to decrease the vertical dimension. Incisal guide table, basically it represents the lingual slopes of the maxillary anterior teeth along which the lower incisors move. Thus, it serves as the anterior guidance for mandibular movement. Horizontal guidance represents the lingual slope of anterior teeth, and lateral guidance represents the lingual slope of canines or maxillary posterior teeth. This is the incisal guidance, and customized incisal guidance is in progress. Programming the articulator, basically some of the things that program the articulator programming is done with the help of different records. First is the Facebook record, and then are the different you can say interocclusal records. For example, the when we ask the patient to close in the mouth in centric relation and then transfer the cars in, they are still closed down in you can say centric relation, and then they are moved to the articulator and then are mounted. That's how the centric relation is transferred from the patient's mouth to the articulator. Also, there is protrusive record in which the patient is asked to protrude its mandible and then close it, then close the mandible. This is used in programming the articular eminence or of the articulator. Before to set up the articulator must be programmed or customized to the individual patient. A programmed articulator simulates the mandibular movements of the individual patient, so teeth can be arranged in harmony with the mandibular movement of the individuals. The programmable parts of articulators are the condylar guidance, both horizontal and lateral, and the incisal guidance. Horizontal guidance is done by using interocclusal records like centric and eccentric or the protrusive records. Patient is asked to protrude the mandible and the relation is recorded using a suitable bite registration material. Condylar lock nuts are loosed and are free to move. The occlusal rims in protrusive and records are placed on articulator and the condylar inclinations are adjusted. So this is the interocclusal check record. Uh, this is most probably patient is asked to protrude the mandible 6 millimeter and then asked to close down. Lateral condylar guidance can be transferred by using lateral interocclusal check records. Patient is asked to move the mandible to one side, either right or left side, and then patient is asked to close, and it is the interocclusal record is taken. Lateral records are made separate for right and left side. This is the, you can say, the centric relation. This is the protrusive record. This is the right lateral, and this is the left lateral record. Lateral interocclusal records. The patient is guided into working excursions on the right and left sides. So Hanau formula also it is used to calculate the record either in spite of recording the patient into the patient's mouth. A formula is used, and in this only protrusive record is taken and lateral record is calculated by this formula. Protrusive record, H represents the protrusive record. Incisal guidance is programmed. Incisal guidance basically represents the lingual slope of the upper anterior teeth and influences the horizontal and vertical overlaps of teeth that has significant effect on the aesthetics of anterior teeth. Incisal guidance should be as shallow as possible in order to minimize the interferences. This is only you can say this is applicable in complete dentures, and shallow incisal guidance improves the stability of dentures. It has two components: horizontal, which controls the anteroposterior movement of the lower jaw, and laterals, that controls the lateral movements of the lower jaw. Excuse me. I don't know why this app keeps crashing down. So we are discussing the programming of articulators and incisal guidance. So, so yeah. So this is the fabrication of a prosthesis is underway over the articulator. So this is was some of the brief introduction towards the articulators. Articulators are basically, they are mechanical devices, and in these kinds of topics, the part of concept is dealt in lectures, and the major part is discussed in clinical rotations. So hopefully, inshallah, we'll be seeing you in clinics as well. And the articulators that the students are having are some of replicas of now articulators, and we will be discussing the the detail of this topic in the clinical sessions as well. So for now, this lecture is complete. Thank you so much.